Welcome to Pulse&Pressors, where critical care gets crystal clear. Today, we're talking about dopamine. When we talk about dopamine, we're talking about a drug with multiple personalities, because its effects completely depend on the dose. At low doses, between 1 and 3 micrograms per kilogram per minute, dopamine acts on D1 receptors in the renal and mesenteric arteries. This leads to vasodilation and increased urine output. For decades, this was called renal dose dopamine, but modern studies have proven that it does not prevent acute kidney injury or improve renal outcomes. At moderate doses, around 5 to 10 micrograms per kilogram per minute, dopamine stimulates beta-1 receptors in the heart. This increases contractility, heart rate, and cardiac output, a true inotropic effect. At high doses, above 10 micrograms per kilogram per minute, alpha-1 receptors take over, causing vasoconstriction, increased systemic vascular resistance, and a rise in blood pressure. However, this also increases afterload and myocardial oxygen demand. Mechanistically, dopamine acts through G-protein-coupled receptors, increasing cyclic AMP and calcium influx in cardiac myocytes, resulting in stronger contractions and dose-dependent vascular changes. Clinically, dopamine may still be used in cardiogenic shock, especially if the patient is bradycardic or mildly hypotensive, and other pressors are not ideal. But it has fallen out of favor because of its unpredictable effects and higher arrhythmia risk. Contraindications include tachyarrhythmias, pheochromocytoma, uncontrolled hypertension, and hypovolemia. Fluids must always come first. Compared to norepinephrine, dopamine has a higher chance of inducing tachycardia and arrhythmias, and it's no longer first line in septic shock. The key takeaway: dopamine's value lies in its dose-dependent versatility, but that same variability makes it less predictable and often less safe than other agents. Next, we'll look at dobutamine, a cleaner inotrope with sharper beta-1 precision and fewer vascular side effects. This is Pulse&Pressors, providing a daily education on the marvels of the human body. Watch the video on dobutamine, milrinone, and digoxin, and subscribe to stay sharp.